Today, we are joined by Dr. Bobby Gostout. Thank you so very much, Dr. Gostout, for joining us today. You had a phenomenal talk today at Grit on leadership success and building your pathway and your identity and finding your purpose in leadership. And we appreciate you taking out the time to do this.
Certainly, you're one of the visible leaders for us, and you have a very interesting story. And so, can we start off and just tell us a few interesting things about yourself?
Well, I would say that one of the most interesting things in the context of this Grit conference is that I have had the privilege of landing in a place that one would never, ever predict from my beginning in my little town of 365 people. And the idea that I am now not only a physician at Mayo Clinic, but have a leadership position is just a magical and unexpected outcome.
And you're doing a fantastic job at all of those things and are a role model to many of us.
Oh, yes. You're leading us with grace, authenticity. You embrace vulnerability. You set great examples for us. So what does grit mean to you?
Grit. This is such an event. It is a coming together of women from so many different backgrounds, and all of us having, I think, the common journey of finding our way, often in a world where we're the minority gender, and finding our way to contribute and find our voices. So to me, it means renewal of that inner fire so that I can take back a stronger me and hopefully help the other people here at this conference take back a stronger them to do the really important work we do in healthcare.
Certainly, and you talked about that with our passion today, and also you really, I think, invigorated the audience by saying all of you and all of us are a success by being here because we're in healthcare, we're in a leadership role. And I wonder if you can talk a little bit more about your leadership and some of the points that you spoke about today in the between taking risk and feeling safe and the need to do the latter.
Sure. A couple of times I quoted Dr. Brene Brown and her wonderful work on how leadership is inherently associated with taking risks. You put yourself out there. You're not blending in. And that's a very visible and then vulnerable place. So when you think of the vulnerability and the risk involved, it would be easy to say, no thanks, I think I'll play it safe. But Dr. Brown also says that place of vulnerability and taking that risk is also a place of incredible creativity, innovation, and joy. And to me, that's what I find is the magical thing that makes it worth stepping out there, is then watching what can happen when you lead and help other people to find their strengths and their opportunities and use their gifts. And you watch transformations happen. It's what makes it worth it.
Absolutely. You are in a very critical leadership role within our organization. You're the vice president of operations. You work closely with our regional practices, and there is just so much change going on within healthcare, taking risks and balancing ethics, remaining curious about who we are serving and how do we do this all in a good balance. It certainly is not easy. You had some really good examples of how to use that power of curiosity and how to combine it with hazard and risk taking. And we would love for you to share that with our listeners.
Well, I love the theme of curiosity. And when I look at my journey from my itty bitty class, I had 12 classmates in elementary school. But when I look at my journey there, it certainly has not always been, I know exactly where I'm going and this is the next step to build to that step. But a theme woven through all of it is being very curious about, and what else is possible. And it's through that I think step by step I have arrived at this place, which is, again, such a privilege to do. But the poet David Whyte writes, the pathways that we take by hazard and design are nourishing in themselves. which I think is a beautiful reminder to not try to rush to the end point, but this pathway and the curiosity that lets you say, well, I wonder if I could, I wonder if I should,
Right.
and stifle down the voice that says, but there's risk. This pathway is nourishing in itself. And then as a bonus, you get to this place of a very varied career, so many different opportunities, so many different muscles to flex. I love my work as a GYN oncologist, but it's absolutely enriched by the other things that have come along because I've been able to stay curious and been lucky.
And you've had like a very interesting path, as you shared with us earlier today. Within medicine, you explored, you were curious, you went through a few different identities before you settled on the one that you felt was the most empowering to
Right.
you.
Right. Yeah. So I started college as a biology major and absolutely loved that study, but realized partway through that I wasn't going to be able to support myself with that. And that at the end of 4 years, I knew I needed a job. I'm from a big family. I had been working minimum wage to get myself through college.
Yeah.
I needed a job.
Yes.
And so switched into nursing, which was a very practical choice and also a very enriching choice. It got me in hospitals watching healthcare teams and really seeing who does what and how does the whole composite of healing take place. And for me, growing up in a family with 5 sisters, relationships and language were so important to survival, to getting along, to working
Yes.
things out. So in healthcare, I was looking for kind of what is it that makes a difference and realizing that that same thing, relationships and language, are so key to the total experience of healing. And I realized that good medical care, the right medication, the right treatment, the right therapies are all vitally important. But the language that we use to help our patients through the threat of being sick, the language that we use to help our team to see, I know my role, you know your role, collectively we'll do this, all of that is part of making the healing event what it could be. So for me, it was that realization. If I want all this to happen on behalf of our patients, then I better be ready to own it and go to medical school. I found my way there through
Yeah.
that unusual and unexpected pathway.
It sounds like you certainly found your passion, and that led you. And you talked about wanting or feeling like there was something more. And you also talked about sometimes on the path, you're just kind of there, not sure what's going to come next. So how do you, I don't know if it's balance, being in the moment and in the moment of your career
Right.
versus looking at what's next and the next opportunity.
Yeah.
Do you have any wisdom?
Such a good question. And I think there's a really important foundation there, which is always that today's work is absolutely your best opportunity to prepare for whatever tomorrow brings you. And so I think it's important that we always keep attuned to finding our passion for today's work. You can't stop doing today's work until you are doing tomorrow's work. And so I think that
Yeah.
each day it is a gift. You know exactly what you're called to do today. Even if you're exploring what's next, it can't ever deflect you from today's work. So I think that's really important.
You know, what's really fascinating was, to me, during your talk, the fact that you've had lived realities in many different pots, pop up sort of pockets of healthcare, yet you retain your curiosity. Because sometimes, you know how it's like, oh, been there, done that, I know exactly how this works. Is that challenging with, you know, you've known so many different pockets, nursing and, you know, with your path, OBGYN and leadership, like, how do you stay curious when you know exactly what those pots look like? Because I feel like that adds to your understanding of the complexity of the whole structure, of how it needs to come together. How does that affect your curiosity?
Well, you said it earlier when you said so much is changing in healthcare.
Yeah.
So the job that I do as a GYN oncologist is absolutely not the same job I did when I began more
true.
than 20 years ago.
Yeah.
And the job that I'm doing, leading our health system and contributing to the vision for our whole organization, is absolutely not the same job it was 12 months ago or 24 months ago or 36 months ago. So we are rich in opportunities to stay curious because things are really changing. But within there, finding the opportunities. It's easy to see change, first of all, as the, oh, good grief, I don't want to do that. But there's opportunities in there.
Yeah.
And as we look at the health system now and say, so how are we going to solve the crisis of rural health care?
Right.
How are we going to connect with our patients in new ways?
Right.
As we close some doors, how are we going to open other doors? It's a new puzzle.
Right.
And plenty of room for curiosity.
Yeah, as much as change is necessary, it's not comfortable.
It is not
And
comfortable.
I think it leads to our branch points. Is it good change, or is it change that needs to change? Because
Right.
it's not a change in the right direction. And I think like your whole team has worked very vigorously towards evaluating the impact of change. Because you're right, we can't fight the fact that we have to change. But following up and remaining curious on the effect of that change is also important. So what are the top 3 takeaways you'd like to leave our listeners with?
So I would say remaining curious, making sure that you have a determined effort to look at things afresh all the time. The people that you're with and the opportunities that you have. I would say learning from successes and failures. There's lessons in everything that we do. And taking the time to reflect and understand what's in it for me is certainly key to growth. And then closing that out with a very conscious decision to thrive. We are not here to just muscle on through and it is terrible. We are put on this planet with, I'm sure, a full intention to enjoy and to thrive. And so really making that conscious choice that let's make this fun. And grit is one of the ways you feed all that. Like, you can do this hard work of being in healthcare and we're going to thrive. So thank you so much for helping to make that thrive thing really come alive.
It's the energy. Thank you, because you certainly, you and our faculty and our leaders who are supporting us are contributing to the, supporting our effort, the energy to get
Yes.
so many people here and leaders to hear from you and your wisdom and really your role modeling and what you've done and how you've done it is certainly impactful for all of us.
Thank you.
And we truly appreciate how honestly you shared all your experiences of what worked, yet what did not work, and what your takeaways were. And you just were so open about sharing all of that so candidly with us today. So thank you so very much.
Thank you.
Thank you.